Good morning, animal lovers. Sorry it is so dark in here. Hopefully you guys can see me okay. I am Liana, the owner of Wet Noses Pet Sitting, and today I wanted to talk about what you do for pet sitting if you have a diabetic pet. So we had a woman contact us just recently who has a newly diagnosed, I believe, dog with diabetes, and so she was definitely very concerned about that, and it seemed like a great topic to cover. So I wanted to go ahead and cover that. So first off, having an animal be diagnosed with diabetes can be very frustrating and concerning and alarming. It's definitely a scary process, and yeah, it's just, sorry, I've got notes and I'm not used to talking with notes. So it's a very scary process, and unfortunately we're seeing it more and more these days. So you do see a lot of pets. We're seeing dogs and cats all the time get diagnosed with diabetes. So for us, it's not a huge deal, but it can be really alarming if this is the first pet that you've had with diabetes. I was looking up statistics this morning, and apparently since 2006, dogs have seen an increase in diabetes diagnosis of 79.7% and cats of 18.1%. Those are huge numbers. And why animals get diabetes is a conversation for a different day. But it is definitely something that is happening more and more frequently. So if you are thinking of leaving town, the question is, what should you be doing? Should you be leaving town? Is that a good idea? So the questions that I would have for you as a pet owner is, how stable is your pet? Is your pet still getting regular changes in their dosages of insulin? Are they still being tested every day? If they're getting glucose tests regularly, how are they with their glucose testing? So if you're having to talk to your vet a few times a week and you want to go on a 1-month vacation, maybe this isn't the best time. So maybe you should get a little bit more stabilization done first. If your pet is still getting glucose testing regularly, that's fine. But how are they with the glucose testing? And how are they being handled by strangers? So if a stranger is going to need to come into their home and prick them with a needle and do glucose testing and then give them an insulin injection, how is your animal going to handle that? Is that going to be really, really stressful on them? Dogs tend to do better than cats, but definitely cats are a high concern. So if you've got a cat that doesn't deal well with strangers and just doesn't love every stranger coming in, that's a point of concern. Does your pet in general get stressed when you leave town? So if you're leaving town for when you have a pet sitter in general, do they normally get stressed? And how does your pet eat when you're gone? So of course, because insulin is a sugar-based concern, if your pet is not eating and they have to eat before they get their insulin, then that's going to be good for a pet sitter. If your animal eats just fine, if your dog is a Labrador that would sooner die than miss a meal, it's probably not going to be a concern. But if you have an emotional animal or one who gets stressed easily or tends not to eat when you're gone from the house, then this might not be the best time for you to be traveling, at least until it gets a little bit more stable. So those are some of the questions that we would ask and that we'd want you to think about. If you decide to travel and you decide to go ahead and get a pet sitter, whether it's us or another company, some of the things that we would really need to know are all of the details that your vet provided to you. So if you're doing glucose testing, what are normal ranges and what would be concerning ranges? What levels of insulin should your animal be getting? How much food should they be eating? Sometimes vets will tell you if your animal only eats half of their diet, then you need to decrease the insulin level or increase the insulin level. So if they eat something extra, maybe they need to have their dosages changed. So we need all of that data so that we can take care of your pets. If your animal is newly diagnosed and has not had a pet sitter since your animal has started getting insulin injections, then you're going to want to have the sitter probably try a few times, maybe even do some practice visits. If we have any concerns, we always require a practice visit to make sure that even if you're not home, the sitter is able to get your animal to eat normally and to give them their insulin injection without too much of a problem. For us, all of our sitters are able to give insulin injections and do glucose testing. For new sitters that are learning it with us, we usually have them be supervised by someone else, by a manager the first few times, just to make sure that they don't have any questions or problems. And with every household that's doing any sort of insulin or glucose, we always have you show the sitter what your routine is. So that way they're doing it the same way that your animal is accustomed to doing it, so they can get it down pat just the exact same way. If you're worried, we would definitely do those trial visits just to make sure that there is not a problem there. Some other things, I'm going to flip my notes real quick. Grab my notes here. Thank you guys for joining me. If we're watching your pet, especially if they're in early stages and they're still having their dosages changed, we really need you to talk to your veterinarian and let them know that we're going to be watching your home and your pet and that we might be in touch. Ideally, we can reach you and you can converse with your vet, but sometimes we're either not able to reach you or it just makes more sense for us to just talk directly to the vet and get some advice, especially if we have a question that we're having trouble with communication or we just don't quite understand. Then sometimes it's easier for us just to contact your veterinarian directly. So we want to make sure that we can reach them and that they're going to feel comfortable talking to us. And if your animal, especially if your animal has any concerns about eating, we really need any tips and advice that you have about how to get them to eat. I can tell you that there have been multiple times where I have been sitting on the floor with a shy dog trying to convince them to eat from my hand or eat some canned food or something with a little bit of peanut butter because they're nervous and they're worried about their parents being gone and they don't want to eat and I can't leave and get, or make sure that they get their insulin until they've eaten. So those are all concerns. Thankfully, I will say that unfortunately, diabetes is really common these days, but because of that, pet sitters have a lot of experience taking care of animals that are diabetic and being able to recognize the signs and the symptoms that are concerning. So you should not be worried about traveling at all. You should definitely feel comfortable taking off. If your animal is newly diagnosed and they are a high stress animal, you might really want to think about whether now is the perfect time. But once your animal is stable, or if your animal is not prone to stress, then I would just say travel and have a great time and just try to be in touch so that your sitter can ask questions if necessary. But this is just one of those things of life that just happens, and just like giving pills and whatnot, it just is kind of go with the flow these days. So if you have any concerns or if you have any stories about your diabetic pets, I'd love to hear from you. And thank you so much for joining us. Thanks for watching, and say hi to your pets from us.